Hello, my name is Gabriella. Today we're going to be talking about Christine Gainey, a Pennsylvania nurse who has been charged with neglect of a care-dependent person, involuntary manslaughter, and tampering and falsifying records. So a little background on the situation. Her patient was an 84-year-old man in a nursing home facility who had suffered a fall and hit his head. So he had a serious head injury. He was ordered neurological examinations every 15 minutes for the first hour after the fall, and then every hour for a certain amount of hours after the fall. It is shown on a security camera that the man was wheeled into the lobby of the facility in a wheelchair and sat there for hours and hours without anybody coming to check on him or assess him or anything. So the nurse, Miss Gainey, who was in charge of his care and was supposed to be conducting these neurological assessments, failed to do so. Later that night, or the next morning, rather, the patient was found to be deceased around 7 a.m. So when the nurse, Miss Gainey, was questioned about the neurological examinations, what was the patient's status, how was he doing leading up to his death, she produced documentation of neurological assessments. She had charted that she had been conducting these neurological assessments every 15 minutes and every hour as was ordered, and she even documented an assessment, a neurological assessment, at 7:20 in the morning, even though the patient had passed at 7 in the morning. So obviously it is seen on the security cameras that she had not been conducting those assessments and she had been charting that she had. Now we're going to briefly talk about some of the ethical dilemmas faced by this nurse, Miss Gainey, in this situation. The first one is failure to assess her patient. As the nurse, it is your responsibility, it is your duty to frequently assess your patients. How are they doing? Especially after something like a fall and a head injury, when it is ordered by a physician to conduct neurological assessments. You're supposed to be assessing their level of consciousness to determine if the injury is worsening, if there is a possibility of a bleed or anything that might indicate a decrease or worsening deterioration in the patient's condition. So she failed to assess this patient. The next one is neglect of a care-dependent patient. This man was 84 years old. He was dependent upon the care of nurses and other staff in this nursing home, in this facility that his family had entrusted with his care, and his life was completely in their hands. So he and his family were trusting these people to take care of him, to watch after him, and make sure that he was okay, or to take action if he was not. And they failed to do that in this instant. The next thing is falsifying documentation and charting. This nurse was documenting that she was conducting these assessments, that she was checking on this patient, that his neurological status was fine, when in reality she was not assessing him, and there was no way for her to know what his neurological status was after this fall, because she had not seen the patient, she had not assessed the patient, she had not been with the patient. So it is a legal document, and she was writing false information in these documents and charting that she had done things that she had not. She has also made false statements claiming to have performed those neurochecks. So in some reports, it is mentioned that when the patient was found to be deceased, the supervisor called her and asked her what happened. Were you performing the neuro examinations? And she said, yes, I was. And she remained that she had been until it was brought to her attention that he passed at 7 a.m. and she had charted a neuro assessment claiming that he was fine at 7:20 after his time of death. It was at that point that she changed her story and admitted, no, she had not done the neuro assessments. So all of these formally mentioned things are things that we find to be ethically wrong. And we think these are all dilemmas that the nurse faced in making these decisions and taking these actions.
There are four main principles involved in ethical decision-making. In this case, the nurse involved, Christian Gainey, violated nearly all of these principles. However, three ethical considerations really stuck out. First, veracity, which indicates always telling the truth. This nurse violated veracity when she documented that she had completed neurological assessments even though she had not completed one neuroassessment the entire time she cared for this patient. Nursing is considered one of the most trusted professions, so violating the ethical consideration of veracity is especially harmful to the profession because we need our patients to trust us so that we can help them heal. Next, she violated the ethical consideration of fidelity. Fidelity is the idea of always doing what is promised. In a way, fidelity is the other side of the coin when it comes to veracity. I wanted to mention it though because she not only lied in her charting, but she also broke a promise. When Christian Gainey became a nurse, she promised to provide care consistent with the nursing standards of care. When she became employed at Cathedral Village, she promised to follow their rules and protocols. Thus, she broke a promise when she did not complete her hourly neurological checks after Herbert McMasters suffered a head injury. She broke a promise not only to her patient, but also to her employer and to her profession. Finally, I believe that this nurse broke the ethical consideration of non-malfeasance. She caused the patient undue harm by leaving him in a wheelchair in the lobby while he suffered a cerebral herniation. By not completing her duties as a nurse, she inflicted harm on the patient. The nurse, in this case, knowingly violated multiple ethical principles. Due to her negligence, an innocent man died alone and without dignity. This case displays all the reasons nurses need to keep ethical principles in mind and practice them every day.
There are many lapses in the ANA's Code of Ethics. I selected a few of the different provisions. For example, Provision 1, the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. Provision 2, the nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. Provision 3, the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. Provision 4, the nurse has the authority, accountability, and responsibility for nursing practice, makes decisions, and takes action consistent with the obligation to promote health and provide optimal care. Provision 5, the nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. And then Provision 9, the profession of nursing, collectively through its professional organizations, must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice into nursing and health policy.
So the resolution of this case was the police and the Office of Attorney General agents. By watching the surveillance footage, they determined that Christian Gainey did not perform a single neurologic exam on the patient following his fall, even though she was supposed to do 8 of them. She was then taken into custody and charged with neglect of a care-dependent person, involuntary manslaughter, and tampering with records in connection. So how could this have been prevented? Well, first of all, the cause of death was an untreated subdural hematoma from a blunt impact head trauma, or the fall. Evidence revealed that Gainey did not administer a total of 8 required neural checks to Mr. McMaster after he had an unwitnessed fall at the facility. The nurse should have actually performed these assessments and should not have charted them if they weren't completed. So really, this is a case of neglect, because if she had just done her job as a nurse to care for the patient, he had a fall. Like, she should have taken care of him and assessed him. That way she could have probably picked up on a sign of the subdural hematoma and then appropriately chosen an intervention. So these neurological checks could have showed the severity of his injuries, and the nurse could have then taken steps to save his life.
What was the impact on the profession of nursing and with the colleague of the person involved? In Gallup's 2018 poll, nurses were again the most trusted profession in the US. Many people trust nurses to take care of their lives, but some people may have lost trust in nurses from this situation. Moreover, the co-workers of the person involved may have been questioned about did they observe unsafe practice and not speaking up. What was the impact?
Hey guys, my name is Sade, and today we're going to be talking about ways to prevent these events from happening in the future. So the first way to prevent abuse or neglect from happening is the nurse must first understand what abuse and neglect is, and to understand and have an important aspect of good practice, they are able to detect neglect and abuse and understand how severe the consequences can affect their patients. So another way is following the hospital's procedures and protocols, which is a form of primary prevention. These include frequent neurological assessments that are required for patients who have experienced an unwitnessed fall to identify any cognitive decline or change in their cognitive status. These checks consist of tests of motor and fine verbal skills, a measure of eye response to light, and a check of vital signs. Understanding the risk factors includes understanding that your patient may be of old age, they may have cognitive decline and dementia and mental illness, physical impairments, and being dependent on help and care of being isolated. All of these factors are very important in understanding ways to prevent felony neglect from happening in the future.